We're told that getting older means losing our edge. We're told that forgetting a name or misplacing our keys is just a natural tax we pay for the passing years. We blame the stress, we blame the lack of sleep, and eventually, we just blame time. But what if the fog in your brain isn't coming from aging at all? What if the very thing kept in your medicine cabinet, the cure you trust every single morning, is actually the thief? Right now, millions of people over 50 are caught in a hidden cycle. They take a pill for blood pressure, another for cholesterol, maybe something for nerve pain or a restless night. It's called the gold standard of care. But beneath the surface, at a cellular level, a silent war is being waged. Modern medicine is keeping us alive longer, but at what cost to our independence? Recent breakthroughs suggest that nearly 70% of common prescriptions have documented neurological side effects, yet most patients are left completely in the dark. From the brain drain caused by anti-seizure meds to the hidden nutrient depletion triggered by daily diabetes treatments, the connection is undeniable. We aren't just talking about a little confusion. We're talking about a systematic erosion of your most precious asset, your memory. Your doctor might call it normal decline, but the data tells a much more alarming story, one that involves over 200,000 patients and a staggering rise in cognitive failure. In the next 12 minutes, we are going to pull back the curtain. We will identify the specific medications that act as silent saboteurs, and more importantly, we'll reveal the scientific shield, the simple, natural interventions that can protect your neurons without you having to throw away your prescriptions. Your mind is your identity, it's your history, and today we learn how to fight for it. This is Healthy Body Science, and the truth about your medication starts right now. Millions of Americans over 50 take daily prescriptions for blood pressure, diabetes, cholesterol, sleep, or nerve pain. Over 66% take at least one, many take 5 to 9 different drugs at once. Yet most studies on side effects don't track memory or cognitive decline fully. That's why when your memory fades, it's often labeled normal aging. Here's the first shock. Nearly 70% of medications have documented neurological side effects, yet most physicians know only 1 or 2, and that's just the beginning. Let's start with anti-seizure drugs like Gabapentin and pregabalin. Millions of adults take them daily for nerve pain. A 2022 study of 210,000 patients revealed dramatic increases in memory lapses, cognitive decline, and even heart problems. Here's the kicker. Gabapentin is sometimes prescribed to treat nerve pain caused by other medications, so it can worsen the very problem it's supposed to solve. Mechanism? Subtle, invisible. It interferes with neurotransmitters, slows brain signals, and erodes memory over time. Later, I'll reveal a simple nutrient that can protect your brain, even while you take these medications. You'll want to stay for that. Next, cholesterol and blood pressure drugs. Statins lower cholesterol, good for your heart, but they also reduce CoQ10 in the brain. CoQ10 fuels neurons. Low levels equals slower neuron communication, leads to memory decline. Blood pressure medications? They can subtly reduce blood flow to the brain, especially over years or when combined with other drugs. Here's a fact that surprises most people. A patient over 65 taking both a statin and an anti-seizure drug may see faster cognitive decline than normal aging predicts. And here's where it gets more concerning. Metformin, the most prescribed oral diabetes drug in the U.S., over 30 million Americans take it. Long-term use depletes vitamin B12, critical for nerve and brain health. Low B12 equals memory lapses, confusion, slowed thinking, mood changes. Metformin also increases homocysteine, which damages blood vessels and reduces oxygen delivery to the brain. Some patients experience this effect silently over 3 to 5 years before symptoms appear. And there's another commonly overlooked drug that damages memory. We'll cover it shortly. Trust me, this one will shock you. Sleep medications, proton pump inhibitors for acid reflux, and polypharmacy are extremely common. Many sleep meds disrupt neurotransmitters essential for memory consolidation. Antacids deplete magnesium and calcium, which your brain desperately needs. Stack multiple medications, and subtle cognitive decline can accelerate without warning. For adults over 60, some take 9 to 13 medications at once, each adding a small but cumulative risk. This invisible danger is something most doctors don't warn you about. Here's a real example. A 68-year-old patient taking Gabapentin, a statin, and Metformin noticed memory lapses over 18 months. Doctors initially said it was just aging, but when B12 and CoQ10 supplementation was added, without stopping medications, cognitive function stabilized. Lesson: knowledge plus intervention can protect your brain even while taking medications, and in a moment I'll show you how to do it safely at home. Shocking study: over 210,000 adults on gabapentin or pregabalin were tracked for 5 years. Memory decline, cognitive issues, and cardiovascular events rose dramatically, sometimes in as little as 3 months. The very drugs prescribed to help nerve pain can quietly harm your brain and body. But there's hope. Understanding the mechanism allows preventive action. Later, I'll show you the 5-step strategy to protect your memory without stopping your medications. Stay tuned. Here's what research shows. Methylcobalamin, B12, 5-MTHF, vitamin B6, and CoQ10 can shield neurons and support memory. Other studies show that simple lifestyle tweaks, walking, sleep hygiene, balanced nutrition, and stress management dramatically reduce the risk of cognitive decline, even with multiple medications. And here's a tip most doctors don't give. Combining nutrients with lifestyle changes often stabilizes memory faster than medications alone. Later, I'll show a daily routine under 15 minutes that anyone can do to protect their brain. You won't want to miss this. Now, let's talk about the medications doctors rarely warn about: sleeping pills, acid reflux meds, and some cholesterol drugs. Each of these can silently erode memory over years, even if you feel fine. In some cases, the effects are subtle but combine several drugs, and the decline accelerates dramatically. I'll reveal the hidden connection between these meds and memory loss in just a moment. You'll be shocked how many people take these every day. Knowledge is your first line of defense. You are not powerless. You deserve to understand your medications, protect your brain, and maintain independence. This is healthy body science. Stay informed. Stay independent. And if you want to learn the full 5-step daily routine to protect your memory, watch the next video. It could change everything about how you take your prescriptions.